Macular degeneration is a disease which affects the retina. In this video, we will describe the symptoms of and treatment for macular degeneration. The retina is the layer at the back of the eye which helps us to see the world around us. Macular degeneration causes changes in central, fine, detailed vision. Images which were once clear may appear blurred. Straight lines may become distorted or curved. Colours may appear less vivid or darker. Later, dark spots may appear and enlarge. The eyes work together. When one eye loses vision, it may not be noticed because the other eye is still able to see. So it is essential for each eye to be tested on its own, with the other eye covered, to identify changes in vision. The symptoms of macular degeneration may be found in other eye conditions. It is very important for an eye health professional to perform an examination to ensure that no other conditions are present. Macular degeneration affects the health of the retina. Here, a cross-section of the retina can be seen. Macular degeneration can be grouped into two forms, early stage and late stage. In the early stages of macular degeneration, with age, metabolic waste products collect underneath the retina. These deposits are called drusen. In these early stages, there are typically no noticeable symptoms. Vision is normal. The macula may stay at this stage indefinitely or may progress to late stage. There are two forms of late-stage macular degeneration, atrophic or dry MD, and neovascular or wet MD. In dry macular degeneration, over time, the retinal cells may die leading to atrophy. This is the slow form of the disease which may cause central vision loss over considerable time. Every patient has a different course, and some patients preserve vision for a very long time. Your eye health professional will monitor your eyes. Ask about how stopping smoking, changing your diet or vitamin formulations can help to slow the progress of dry macular degeneration. Wet macular degeneration may develop in patients with the early or the dry form of the disease. In the wet form, abnormal new blood vessels that are fragile and leaky begin to grow into the retina. Unlike normal blood vessels in the rest of the body, those seen in wet macular degeneration cause swelling or bleeding into the retina. Wet macular degeneration can cause a sudden and severe loss of vision, as these vessels continue to leak fluid or bleed. If untreated, vision loss will usually continue to progress and eventually become permanent. In wet macular degeneration, abnormal fragile new blood vessels begin to sprout. A molecule known as vascular endothelial growth factor, or VEGF, is released, causing wet macular degeneration. VEGF binds to its receptors much like a key entering a lock. VEGF is a signal which causes the abnormal fragile and leaky blood vessels to form underneath the retina. As these abnormal blood vessels leak and bleed, the retina becomes swollen and vision begins to progressively decline. The main treatment for wet macular degeneration is an injection of medication into the eye. This medication is delivered into the vitreous gel in the back of the eye after numbing and cleaning the eye, and most patients experience only minimal discomfort. These medications work by binding to the VEGF that is released, much like a sponge. As a result, the VEGF cannot bind to its receptors. These injections slow or stop the growth of the abnormal vessels, and in most patients, serve to preserve vision or reduce the risk of vision loss from wet macular degeneration. As with any medical procedure, injections carry risks each time they are performed. The drug in the eye lasts only a certain time, and repeated injections are usually essential to preserve vision. Talk to your ophthalmologist about the benefits and risks of anti-VEGF medication to learn more. For more information and support about macular degeneration or any other macular disease, please contact Macular Disease Foundation Australia on 1800 111 709 or www.mdfoundation.com.au.